Welcome to another edition of Talk Tuesday. Go vote if you haven't voted already. And on today's Talk Tuesday, I want to talk to you about your spine and how it's connected to the rest of your body. So your spine and your mind, I'm just going to talk about the top 3 vertebrae today, and then we'll move on from there. All right, I want to show you this. It's called a Neuro fuse box chart. And the Neuro fuse box effects of subluxation. So for those of you who don't know, I am a chiropractor. Subluxation, what we're looking at is a miscommunication between the brain and the body. And this is giving us the cause and effects of that situation. And so we're looking at the very top vertebra of your spine here. And we're talking about C1 through 3, the upper cervical area. And in that area, some of the primary and secondary functions that happen there. We're looking at your autonomic nervous system. So that is your digestive system, your heart rate, lung function, all those different things. We also follow up with the ear, nose, and throat system, your vision, balance, and coordination, your speech, your immune system, as well as your digestive system. So all these systems here, there's a primary and secondary functions, and that's happening in the very upper part of your neck. Now, a lot of people who have some of these issues or a lot of these issues have other issues here in this part of your neck. They don't attribute it to that. They of course say I have a lot of headaches, I feel this tightness in my neck, this pain, but they don't understand that long-term miscommunication between your brain and your body will end up affecting these primary and secondary functions of this part of your neck. So the tissues, organs, and glands that are connected to, we have your vagus nerve. That's the major one because your vagus nerve is what kind of controls everything in terms of like heart rate and just how your body adapts to stress. You also have your brainstem there, which houses all your cranial nerves. So that gives you the ability to smile, smell, taste, all those different things. Then you deal with your cerebellum, so you're talking about balance. You're also dealing with inner ear and middle ear. So again, we're talking about balance and coordination. Your sinuses, I know a lot of people who say they have sinus infections a lot. So we have that going. We have your pituitary gland, in addition to like your face, jaw, and teeth, and your eyes. So those are tissues, organs, and glands that are affected there. There are some adjustments that we do in the upper area up here, and people are saying, they see better. There's other people here who we adjust there for a while, and then their jaw, the way their jaw and their bite happens, it closes, and it's a lot better than what it used to be. So you have those type of effects there. Then you look over here when it comes to effects or possible symptoms that people could be experiencing when they have issues in this area. And it's not a completely exhaustive list, but this is kind of a list of some of the most common things that people deal with. So when it's babies, we're looking at colic and excessive crying. I know I had a child one time who I was working with, and what I didn't know was that the child had fallen off of a bed. But through my testing and everything that I was doing, I did discover that the child's neck had an issue. He couldn't really turn his head one direction, and so the mom brought him in because of this excessive crying and inability to sleep and all these things. So that's why she brought him in, because it was basically wearing her out. And a friend of hers recommended the child to me. And so when they brought the child in, I was simply doing what I normally do. And we got the child adjusted. The excessive crying went away. His sleep got better. There was all sorts of things that happened with that. So that was a great opportunity for mom to see how chiropractic could really benefit her child. So we're looking at other issues here: epilepsy and seizures, sensory and spectrum disorders, ADD, ADHD. The ADD and ADHD is a major one here, as well as the anxiety and stress and depression, and high blood pressure as well. This second column, these are it's a lot of major things here in this second column, because what you're dealing with is that upper brainstem and a lot of stuff that happens there. Because a lot of things that happen there in the upper brainstem, it's one of those areas where we get a lot of response, a major response to the body, because that's kind of the housing of where your brain and body start to communicate. That's that opening, the gateway of that communication. So if you look at it, your brain is basically extended through your body, through your spine. And in that area where that extension happens, there's so much that goes on there. A lot of people there, they're dealing with the hypertension, they're dealing with the ADD, the anxiety, the depression, all these different things. And by correcting those misaligned vertebrae, the vertebrae that don't move properly, the tissue that's not functioning right, all by eliminating that, a lot of times you see a decrease in a lot of these symptoms that people are struggling with when it comes to anxiety, depression, and all that. So there's a lot more here in terms of dealing with the body. There's several different areas. We're talking about 6 different areas of the body that kind of house a lot of different issues. I just wanted to share these with you because that's one of the major ones. There's also a ton in your lower back. And in your lower back, you're dealing with things like constipation and gas and sciatic pain and all those different things, as well as like infertility and things like that. So that's stuff you look at in the lower spine. But I just wanted to introduce you to this. This is something I give to my clients once we come in, we scan their whole nervous system. It gives you an idea of where you are, what we're looking at, and we can put it together and give you a picture of how your health is. This is Dr. J. Ware, Talk Tuesday. I look forward to seeing you. Give us a call, 317-578-0226, or send us an email, follow us on Facebook, subscribe to our YouTube channel.